We do a lot of stories on the human heart, but this one you'll find a little different. Our reporter, Laura Windsor, has the details.
Thank you, Roger. What made this story different is that I wanted to know if you could be so sad or depressed that you could die. We have all heard of someone who has supposedly died of a broken heart. So we asked Dr. Ramin Manshadi, a board-certified cardiologist from Stockton, California, who has researched the topic, can you die from a broken heart?
There is a condition called broken heart syndrome that we just recently were able to put together and figure out as cardiologists. It can happen from emotional distress or it can happen from a physical distress. So someone can have a significant emotional distress such as losing a spouse or losing a lot of money at once or anything that is significant and severe emotional distress, which can lead to a heart attack, and on rare occasion within these heart attacks, one can die. Studies have shown that a significant number of these, over 90% of these broken heart syndrome heart attack types occur in women, not men. And this is mainly because of hormonal changes that happens. And these women are occasionally and most frequently over age of 50. So they're postmenopausal. So it has to do something with the hormones. And this, in addition to a severe distress and stress in their lives, can lead to this broken heart syndrome. Normally what happens with a heart attack is that the arteries are building up with plaque and fat, and because of risk factors, smoking, diabetes, hypertension, and so forth. What happens in this scenario is that these individuals have absolutely normal arteries. They hardly have any blockages. So this is the interesting part of this broken heart syndrome that we have noted. And in the past, we did not even know why these individuals have a heart attack, because we look at their symptoms. They have chest pain, shortness of breath, and in this case, it happens after severe distress and stress. And their EKG also looks like they're having an acute event, meaning that they're having a heart attack. And we take him in and we do an angiogram on them, and we note that they have quite clean arteries. They don't have any blockages. So we do an echocardiogram, or we do a LV-gram, shall we say, and we look at the structure of the heart muscle itself, and we see this apical ballooning of the heart. The heart, all the parts beyond the base of the heart and the apex of the heart is ballooned out, and it's not functioning at all. The thought is that when someone is under excessive amount of stress and distress, they release these adrenergic hormones, such as catecholamines, epinephrine, norepinephrine, which can bombard the heart and cause this inflammatory response within the arteries, and possibly even cause vasospasm or constriction of the arteries. We're talking about a very deep, severe, depressive and stressful situation that can propagate possibly these inflammatory response that can cause broken heart syndrome and heart attack.
Dr. Manshadi, does this broken heart syndrome happen right away after someone has been under excessive distress?
It usually happens within days afterwards, not months later. The peak time, because the first thing that happens, people during distress and stress, there are people in denial and they're going back and forth with God, why this happened. The deep distress and stress has not set in yet, and eventually within few days, this is the peak time that this can happen.
So maybe the song, Love Can Break Your Heart, has more meaning than we thought. For the American Health Journal, I'm Laura Windsor.